Good afternoon. This is day 15 of the Trump Republican shutdown. And House Republicans remain on vacation, having canceled votes for 3 consecutive weeks. House Democrats are here, on duty, ready, willing, and able to do what's necessary to reach a bipartisan agreement that actually meets the needs of the American people, reopen the government, and address the Republican healthcare crisis that is crushing people all across the country. House Democrats have repeatedly made clear, as have Senate Democrats, that we will not support a partisan Republican spending bill that continues to gut the health care of the American people. We are here to address the serious needs of everyday Americans that have repeatedly been undermined throughout this year by Donald Trump and compliant Republicans in the House and the Senate. The Republican healthcare crisis is very real. The largest cut to Medicaid in American history. Hospitals, nursing homes, and community-based health centers are closing all across the country as a result of what Republicans have done in their one big ugly bill. The fact that Republicans continue to refuse to extend the Affordable Care Act tax credits means that tens of millions of Americans are about to experience dramatically increased premiums, copays, and deductibles that may double, triple, or quadruple, meaning many will pay thousands of dollars more per year, which will make their health care unaffordable. Republicans have also set in motion a $536 billion cut to Medicare that will occur at the end of the year if Congress doesn't act because of toxic provisions in their one big ugly bill. Medical research has effectively been halted in the United States of America. And Republicans are proposing dramatic cuts to the Centers for Disease Control and the National Institute of Health. We're witnessing an all-out Republican assault on the health care of the American people. It's unacceptable, it's unconscionable, and it's un-American. And that's why Democrats are standing up and fighting to decisively address this crisis that our Republican colleagues continue to visit on the American people. It's now my honor to yield to the distinguished Whip Katherine Clark.
Thank you so much, Mr. Leader. Here we are again. Another no-show week for Republicans, another week closer to the ACA open enrollment period, another week closer to a catastrophic GOP-made healthcare cliff. This is a solvable problem, but it is an urgent problem, and we need Republicans back in D.C. at the table and negotiating. And that needs to happen now. Despite what Mike Johnson says, we do not have an eternity to deal with this. Families are already finding out their premiums are about to skyrocket. Parents are realizing they cannot afford to stay insured. Let's take Shauna Verstegen. She's a mom of 2 in Wisconsin who says she is sick to her stomach because her monthly premiums are about to rise by $800 a month. That's $9,600 a year. And for what? So Republicans can cut taxes for the billionaire class at the expense of everyone else. And I mean everyone. This is not about party or ideology or geography. Let's ask Alan Reynolds, a proud Florida Republican. His wife has been notified that her premiums are going up $700 a month. Alan said, "I voted for Trump. I did not expect this." We are hearing stories like this every single day. Yesterday, Mike Johnson said he didn't have a strategy. Come on, Mike, don't sell yourself short. You do have a strategy. It's the same strategy the Republicans have always had. Repeal the Affordable Care Act, take from working families, raise their costs, defund their health care, and give that money, all that money, to the very, very wealthiest Americans. It is a losing strategy. It is an unpopular strategy. So, Mr. Speaker, for the sake of your own constituents and mine, why don't you try a new strategy? Come back to work, take a seat at the table, and let's stop this healthcare crisis you created before it's too late. And now it is my pleasure to yield to the outstanding chairman of our caucus, the gentleman from California, Pete Aguilar.
Thank you, Whip Clark, and thank you, Leader Jeffries. As you know, as the Whip just laid out, the Republican-controlled House has not voted since September 19th, nearly 1 month ago. And in that time, House Republicans have continued to be on vacation. They haven't been holding town halls, they haven't been finding out ways to reopen government, and they haven't been working to save Americans' health care. Republican Representative Kevin Kiley from California even called the Speaker's decision to adjourn the House embarrassing and the wrong decision. What have Trump and Republicans been doing for the last few weeks? Refusing to work with Democrats, digging in deeper into their anti-healthcare position, threatening federal workers, and even offering a bailout to Argentina to the tune of $40 billion in taxpayer money. Yesterday, the Speaker admitted that he didn't have a strategy, and when it came to his position, just that he would not negotiate. Well, Democrats have a strategy. Work with us in a bipartisan way to fund government that keeps health care, lowers the cost of health care, and ensures Americans keep their coverage. If Republicans fail to come to the table, health care for constituents in red districts and in purple districts and in blue districts will continue to spike. Republicans are acting as if their own constituents won't be hurt by their decisions and the recklessness that they've created. But the truth is, thanks to the big ugly law and the looming expiration of the ACA tax credits, everyone is going to see their health care costs increase. In some states, Americans are already seeing the premium sticker shock when shopping for their health care plans for 2026. Soon, this will be rattling households all across the country. Enough is enough. It's time for Republicans to get serious, to work with us, to save health care. The country and their constituents are watching. Leader Jeffries.